see. Sorry. Sorry, it's taken a while to catch up. So, right, so we're going to talk about heart health, keeping ourselves healthy and reducing our cardiovascular risk. Okay, so when we talk about cardiovascular disease, what do we mean by that term? And cardiovascular disease, in simple terms, is a disease that affects the heart and the whole of the vessels, whether it's the heart, the veins, the arteries, blood capillaries, etc. I'll just move that other part of the screen so it's just obscuring what I'm seeing. And the main diseases we refer to are coronary artery disease, where there's plaque formation within the coronary arteries. Hypertension, obviously high blood pressure, which will affect the blood and the arteries, where the pressure that's being exerted on the arteries is too high, and that can cause problems. Obviously, stroke, which is something we're going to talk quite a lot about today in terms of the impact that can have, where the blood supply to the brain has been interrupted, whether that might be for a transient ischemic attack known as TIA or a full stroke. And obviously can lead to cells dying, both in coronary artery disease, where the heart cells can die, and then stroke, where the brain cells can also be affected. And then lastly, cardiac arrest. Now that is obviously the most fatal element, but that is also cardiovascular disease, and that's where the heart stops and stops functioning altogether, and any blood and transportation around the body stops. So that is what we mean when we talk about cardiovascular disease. So it's a full range of diseases that can be affected by the heart and the blood vessels. Now, when we talk about risk factors and causes, risk factors can be a number of different risk factors, and some of which we can do nothing about. And I'll go on and talk about whether they're controlled or uncontrolled risk factors. And the most common risk factor is this buildup of plaque in the arteries. So this might be, just as a result of a number of different things, whether it's high cholesterol or unhealthy lifestyle, etc. But obviously there are other factors such as smoking, uncontrolled diabetes, and hypertension. There's family history and genetics plays a big part in cardiovascular disease, and so does our lifestyle. And it's important that we focus on lifestyle when we talk about prevention, but I'll go on and talk a little bit more about that. But unhealthy lifestyle is a risk factor for cardiovascular disease, as is physical inactivity. And also excess weight gain can also be a risk factor. So cardiovascular disease, in terms of facts and figures, is still one of the leading causes of death globally, not only in the UK, but obviously worldwide. And since 2000, we're still seeing an increase. So we've looked at some figures recently and things, so the numbers are still going up. So all the advances being made in cardiology and in stroke, but yet we're still seeing the disease continuing. And that's a real concern for all of us within cardiology or a cardiovascular disease, that, the impact, the amount of work we're doing, the impact is still, there's still more needs to be done. It's not only about cardiac disease, it's also about stroke. And we know that it's still the major cause of disability. A stroke can cause really significant effects on somebody's ability to continue to live independently and have that quality of life. Other factors to consider is obviously the waiting list and the growing impact the cardiovascular disease has on the NHS waiting list and treatment and diagnosis. And, it's just that the system needs to be able to deal with the influx of people that are coming through with this disease. The impact on the last few years, certainly within after COVID, has had a huge impact on all of our lives, whether it's both within our physical and our mental well-being. And the cost of living and our current crisis in terms of challenging times that we're living with has also had an impact on our risk in terms of cardiovascular disease. So in terms of risk, what are we talking about? So when we talk about uncontrolled risk, this is things that we can't do anything about. Age, we know as we grow older, our risk for cardiovascular disease does increase, and that is totally down to changes in our physiology. We know that the elasticity in our arteries and our veins will change and will obviously mean that we will be more susceptible to things like hypertension. Men generally are more at risk than women until women hit menopause. Our hormones will protect us as women until we reach that time in our lives, and then we catch up very, very quickly with men. So we're not protected for long. Certain ethnicities, particularly the South Asian and the African and Caribbean groups, are much higher risk of cardiovascular disease. And also our family history. If your father was diagnosed before the age of 55 or your mother or sister before the age of 65, it puts you at a higher risk for CVD. Now, when we're talking about preventing stroke, I'm going to focus on stroke, but also some of the cardiac elements as well. And we just want to pick up on some of the risk factors that we can do something about. So one of the biggest things we can do something about is adjust our lifestyle. So almost certainly quit smoking and reduce alcohol intake, because they will absolutely contribute to improving our lifestyle to reduce these risks. Regular exercise will reduce hypertension, diabetes, obesity, all of those things. And actually, regular exercise also has other benefits, such as benefits to our musculoskeletal system. So, our whole mobility just continues. Now, we do know that there is obviously a spectrum of ability out there, and exercise means different things to different people. So some people, are required just to consider exercise on chair-based exercise, for example. I have a lady that is, well within her 70s, and she is in a wheelchair, but she exercises regularly. She goes to a class that I go to, in terms of exercise. So, we are able to modify exercise just dependent on what she can do and what her ability is. But the important thing is to continue having some regular exercise throughout your life and adjust it depending on your capacity. An improved diet. If you want to modify your risk and you want to modify your lifestyle, improve your diet. For stroke, in terms of reducing strokes and cardiac disease, reduce the amount of salt that you're taking in. Never add it at the table. You can cook with it, you can have low sodium salt, but don't add it at the table. Increase the amount of fruit and vegetables and reduce the amount of saturated fats so that you reduce your cholesterol. Sadly, 9 out of 10 strokes are affected by high blood pressure. So managing high blood pressure is really important. And I'm also going to talk a little bit about atrial fibrillation, which is a heart condition that affects the rhythm of the heart. And this also, if it's managed correctly with anticoagulation therapy, you can also modify your risk in terms of heart disease. We know that 80% of both cardiac and strokes can be avoided by adjusting your lifestyle. 20% of your risk is uncontrolled, and 80% of your risk is controlled. So it's that 80% we focus on when we talk to people about modifying their risk. So how do we keep ourselves healthy? So the most important thing is to know your risk, whether it's in the uncontrolled or in the controlled element. So know your numbers, know your risk. Remain active within the capacity that you exercise, and obviously it's different for your age, it's different for your capability, etc. But keep moving. Eat healthy, low fats, low salts. Quit smoking, reduce the amount of alcohol intake. And the required numbers are things like 14 units a week, but spread over 3 days. So know your numbers, know what your blood pressure is doing, and keep an eye on it. And, I'm not saying that people should be taking their blood pressure every day or several times in the day, but I think you should know what your blood pressure is doing and keep an eye on it. Know your pulse and how to take your pulse. Get a professional to take your pulse. Every time you see a healthcare professional, ask them to take your pulse. I'll explain why. Cholesterol and diabetes checks are helpful, but you can't have them too frequently because they are absolutely reflective of the lifestyle that you're leading. So if you're eating high levels of fat or sugars, your cholesterol and your diabetes check is, going to come up with high numbers, totally reflective of the lifestyle that you've been living. So, don't have them done too frequently because you're all going to be the same numbers. If you want to change your lifestyle and go back and check your numbers for cholesterol or diabetes, I would say you should wait at least 6 months, if not a year. If you take any medication for cardiovascular disease, ensure that it's optimized. The whole purpose of medication to protect you from any of the risk factors, this is really about ensuring that part or that risk is managed. So if you're diagnosed with hypertension, for example, then you're put on a hypertensive medication, ensure that it's optimized, that blood pressure comes down. So the best outcomes it's about prevention, ensuring that we can know your risk and manage it. Now, obviously, if an event should happen, you need to know what the warning signs are and when to call for help. So if it's a cardiac event, and a cardiac event, I mean something that's affected the coronary arteries of the heart, where cholesterol may have built up in the arteries over time and caused a clot to occur. Now, cardiac pain can manifest in various different ways. Some people will feel it as chest pain, some people will feel it as tightness, some people will feel it as a pressure, and can be associated with exercise and can also be felt up in the jaw, the neck, or down in the arms. If symptoms persist and are included in other symptoms that might occur, things like shortness of breath, nausea, and then you do need to actually take notice of that and call 999. We know that people have an opportunity, a window of opportunity when there is a cardiac event to get that heart muscle back, it being in full of oxygen. If there is a blockage in an artery, it needs to be opened, and that flow down that heart and down to the heart muscle needs to be restored. So the faster people call 999, the better the outcome. We know there's treatment options available. In the Bristol Heart Institute, for example, we run primary angioplasty, and primary angioplasty is that people are pulled straight into theatre. They don't go onto a ward or into A&E, and they are then, that artery is opened straight away. Like I said, there's that window of opportunity to ensure that that muscle is restored. And for stroke, we've all seen the FAST campaign, but just to remind you that this is also very critical in terms of dialing 999, and time does mean brain activity. So whether somebody is having a transient ischemic attack, which is a TIA, or a full stroke, still time is critical, and you need to phone 999. The reason for that is that although we might have had a previous TIA, which has a transient attack and has cleared up within 24 hours, you don't know if this next one is a TIA or a stroke. So always dial 999 and get the experts to make that diagnosis. So when we talk about secondary prevention, so it's important that if somebody is, has had an episode of either a TIA or a stroke, that we need to ensure that they are able to prevent something else happening in the future. And I would still say the message is really focus on lifestyle adjustment. All of the things we've talked about, whether it's about diet, whether it's about exercise, have a regular review with the GP with regards to your medication and any support that's required to ensure that you can live independently or as much as possible. There are driving requirements for both TIAs and strokes. And so if you've had a single TIA, there is no need to notify DVLA, and you shouldn't drive for 1 month. However, if you've had multiple TIAs, you do need to notify DVLA, and no driving for 3 months. And as long as there's been no further TIAs, you can then go back to driving. If however, you have a stroke, this really is dependent on your clinical recovery. And the things that DVLA will look out for, things like if there's any visual disturbances or any cognitive or limb function lasting effect from the stroke. In all cases, no driving for 1 month, and there's no need to phone to notify DVLA unless obviously the recovery isn't good enough to continue driving safely. So that's what the rules are. Ongoing focus, I would say to you, above and beyond the focus on lifestyle and regular review with the GP, is absolutely know your blood pressure, because we know that 9 out of 10 strokes are because of high blood pressure. And know your pulse. I'm going to talk to you a little bit about this pulse that I keep talking about. So this diagram down here shows you what the normal heart is doing. So the normal heart, the heart rhythm starts in the atrium, which is the top chamber, and flows down the middle of the heart, and then both of our ventricles will contract. And when our ventricles contract, that's the heartbeat that we feel, but that also then expels oxygenated blood around the body. In a condition known as atrial fibrillation, or AF, or AFib, sometimes it's called, this produces an irregular heart rhythm. Sometimes it can be fast. And what's happening here is in the atrium, we're seeing that actually different areas within the atrium suddenly decide they're going to fire off. So they will then start causing an irregular rhythm into the ventricles. So we see various times the rhythm will start coming down the middle of the heart, called the bundle of His, and then the ventricles start contracting. So in normal rhythm, we have a nice contraction in the atrium, and then the ventricle will contract. The heart repolarizes, and the whole thing starts again. Very orderly, really controlled. In atrial fibrillation, we see fibrillation waves, we see that actually a bit of sort of turbulence going on with the blood in the atrium. And then we see randomly these F waves will follow down into the ventricles, and we will see a contraction in the ventricle. So sometimes it might be 6, sometimes it might be 2. It's completely random. So there is no order anymore. So because there is no order, what happens in the atrium is that blood is just swirling around, waiting for that contraction to happen. And that's where the danger of a clot comes in. Now, this condition is picked up very, very easily. So if you're having your blood pressure taken in a pharmacy, at the GP practice with a nurse or any other healthcare professional, ask them to take your pulse. And what you want to be looking out for is that rhythm regular or irregular? Obviously, there are some conditions that can cause an irregular heart rhythm, but the one we're looking out for is atrial fibrillation. Atrial fibrillation can cause strokes if not managed properly, and we know that if you have an AF-related stroke, your outcome is a lot worse. So when I say to you, know your numbers, know your pulse, I'm referring to just check if you've got a regular pulse or not. In order to make the diagnosis of atrial fibrillation, you will need to see a healthcare professional who will do an ECG. There are treatment options available, and these treatment options are one, medication to prevent strokes, so that's anticoagulation treatment to ensure that this does not cause turbulence and clots. There is medication available to manage your heart rate and the rhythm, because actually this can make people feel quite unwell. You know, people can feel palpitations, they can feel their heart racing. A cardioversion is a controlled defibrillation of the heart. So it's a managed thing and actually extremely safe, where you're put under heavy sedation and you're given an electric shock, which will restore that heart rhythm back to sinus rhythm, which is normal rhythm. If all of those things don't work or are not suitable for that individual, there is another procedure called cardiac catheter ablation. And this is where we will have the pathway mapped, and we can ablate part of the pathway by burning that tissue, and we can stop that atrial activity following down into the ventricles. Sometimes that might mean that the individual is left with a pacemaker, but not always. It just depends on how much of the muscle needs to be ablated. So it's a condition that can be picked up very easily by checking the pulse, and obviously the diagnosis can be made, and there are treatment options available. Another condition I'm going to talk to you about is PFOs. PFOs are patent foramen ovalis. Now, so sounds like a big word, but what it is that when a baby is in the uterus, now obviously we don't have lungs that play a part when we're in the uterus. So the baby's the fetus's heart has to be able to transfer from oxygenated to deoxygenated. And in order to that happen, we have a hole between both atriums. So there is a hole here in the fetus between the right atrium and the left atrium. And that's exactly how the heart will continue to work in the absence of lungs. Now, once the baby's born, that hole closes within a few days. Sometimes that hole does not close, and that is the window or the foramen ovale that remains open or patent. So once the baby's born, the lungs come into play, that flap just closes and starts, healing over. Sometimes it doesn't happen and that stays open. Actually, majority of the time, it doesn't cause any problems. However, sometimes it can cause some symptoms such as migraines, dizziness, loss of balance, and sadly, in some cases, it's not found until it's a TIA or a stroke. So what can we do about these and how can we diagnose them? So we can diagnose them by doing what is known a bubble study under echo. And what we do is we just put some saline with some contrast in the bloodstream, and we can actually see bubbles going across. And we watch for those bubbles on an echocardiogram, which is an ultrasound test, and we can actually make that diagnosis that window is open. So that patent foramen ovale is in place. There are a number of closure devices that can be used. Here's an example of one. And we just pass this up through the artery, through the femoral artery up through the groin, and we can then get into the heart and we can open the closure device, and it's very much like an umbrella. It comes completely closed within its sheath, and then as we release it, it opens up like an umbrella, and one side of the disc sits on one side of the atrium and the other side on the other one. Obviously, we have to take some measurements on the size of the hole and then pick the right size disc, but these are very successful. And, there's no age limit in terms of people can have them, well into their 60s and 70s. So things that people are having these. So these are two conditions that can cause strokes, but in the majority of people, there is no, doesn't have to be an AF related stroke or a PFO related stroke. It can just be as the result of high blood pressure and those other factors we talked about. So there's a whole range of different reasons. And actually, sadly, we are seeing strokes under 50, 55 quite easily. And it's just something that can happen. So I hope that's been helpful today for you just to understand cardiovascular disease, but also the risk factors and things that we can do something about and things that we're kind of stuck with. If you've got any questions, I'll be happy to answer them.